Hi friends, welcome back. Been an interesting week. COVID-19 and dental hygiene. Let's do it. So COVID-19 or the coronavirus has been around for about 3 months now over in China. I started really hearing about it in February, or actually end of January, just prior to going to Costa Rica this year. And didn't think about it a whole lot. I mean, a little bit while we were over there, but I don't know, something in the back of my head just kept saying, "Hey, this is gonna be a big deal." And I went, "We'll see, we'll see, we'll see." So it's been obviously progressing fairly rapidly. It's here in Colorado as of tomorrow at 5 o'clock. The Denver area is going on lockdown, and I'm just outside of the Denver metro area, so getting a little nervous. I'm headed north tomorrow to see some family and friends just in case there is a lockdown and I can't see like my mom for a couple weeks. So yeah, it's been kind of interesting. So as far as dental hygiene goes, we have here in Colorado anyway. I'd love to hear like what's going on in your states. So if you are a hygienist, comment below. I want to know like what's going on with you guys. But here in Colorado, they've a couple weeks ago they shut down all like elective procedures, which is pretty much hygiene. And it was interesting being on the different Facebook groups and stuff. They were talking about, well, is scaling a root planing an emergency procedure? Is a 4 millimeter turning in a 5 millimeter considered an emergency procedure? Is it no anything? Dental hygiene is not considered emergency. Emergency is this person's face is swelling up, they need their tooth pulled, or they broke it off, or it's never us, it's always the dentists. So something to keep in mind if there's ever an economic downturn or something like this going on, you are an elective procedure and you shouldn't be. I mean, keeping your mouth clean is super critical for keeping your body clean, but most people consider hygiene an elective, and if the economy downturns or if you have some big kind of virus running through, people are not going to come in for their cleanings because it's something they don't feel like they need to really spend their money on. Like they'll come into the dentist because their tooth hurts, but they're not going to come in for a cleaning if they don't have any money. They're going to go use it on food, they're going to use it on toilet paper in this case, but they're not going to be coming in to see you. So that was already starting to affect the dental hygiene community, and then the governor came out and said, okay, you're done. Only the dentists with emergency procedures. And I'm hearing there are some offices that are still open and hygienists that are still seeing patients, which is kind of not a great idea, but at the same time, like, I get it. Like, the dentists are probably going, you have to be here, you're going to lose your job. And I've seen that in some of the groups that people are having their jobs threatened. People have been fired. So, while dental hygiene is a fabulous job and I highly recommend it, with something like this, like you're not recession proof, you're not economic trouble proof, and you're definitely not virus proof. Like this is kind of new for everybody. Even back when we had the AIDS epidemic, which I lived through, but I wasn't a hygienist in. So if you were a hygienist back when AIDS became a huge thing, also comment below. I want to know what like that was like. Was it anything like this? I'm assuming it wasn't. From what I understand, it was nothing like this. So this is kind of the first time everybody's seen this type of reaction. So right now we have a lot of hygienists that are filing for unemployment. We have a lot that have been fired. Again, watching I don't have a job right now. Like I was temping, and I'm personally concerned because when this is all over, if it gets over, we'll see. It's getting a little nuts. It might last longer than we think. I'm hoping not. I'm really hoping this is over soon, but we don't know. At this point, we're just kind of waiting to see. But let's say this goes on for a while. When it does settle down, there's going to be a lot of hygienists that don't have work, that were fired, that have been unemployed, that will be looking for temp jobs, that will be looking for just the marketplace is going to be flooded. So like if I wanted permanent work, it's going to be that much harder now to find permanent work. So that's kind of an interesting conundrum for me personally. I'm a little concerned as to how that's going to turn out. We'll find out. The things to think about if you're thinking about dental hygiene is, do you, have a backup plan in case, like I do other stuff from home. I do Damsel, I do I do some online stuff that's actually going to be kicking up here again this next week, and online marketing and that kind of stuff, which helps bring in some added income. I do Burst, and all that has added income. Doesn't make near the money Hygiene does, but it does help, and sometimes significantly help. So that's awesome. It allows us to take some really cool trips during the year. Typically, we'll see about trips this year. I think we might be done traveling for this year. But yeah, if you're thinking about hygiene, just remember that you're not recession proof, and if there are like a big virus or something that goes through, you are on the front lines because you are in people's mouths, you are breathing in aerosols that you're creating, and you are like 6 to 10 inches from this person's face, and they will come in sick. Well, I'm getting over this cough, but I'm not infectious anymore. Right. Yeah, they always say that. Just like your dentist will go, oh, you have a sore throat? Well, you should probably stay. Oh, you can't talk anymore? Well, you should probably stay anyway. Oh, your snot is filling up your mask? Well, I really can't afford for you to go home, so you're just going to have to work through it. And I've worked for people like that. So you will deal with that kind of stuff too. So when it comes to dental hygiene, we have our personal protection gear and our cleaning routines and everything we're required to do by OSHA. You treat every patient like they have AIDS, like they have Hep C, like they have C. diff, like they have whatever. Like you think of the worst of the worst. That's how we treat everybody. That's how we wipe down the room. That's how we treat the instruments. That's how we... at least that's how we're supposed to do it. Like you need to be wearing a level 3 mask. So I'm seeing a lot of offices, however, not offices. I'm seeing a lot of hygienists again on the Facebook board pages that are talking about how they've just realized that their dentist was buying them a level 1 mask, which is like tissue paper over your face. It does nothing. Because they're so much less expensive than the level 3 masks, which is what's really required. We've got people talking about how like they're not doing their OSHA training like they're supposed to, or how the dentists aren't washing their hands, or how like there's a lot of interesting stuff kind of bubbling up now that people are more aware of like this virus and what's going on with it. So it's interesting just to see people's reactions to it, and like how the hygienists themselves are going to their dentists now and going, hey, why aren't we doing this? Why aren't you protecting me and the patients? Like, what is up with that? And it's good. It's calling a lot of dentists and business owners into accountability, which I think needs to happen, because while there's a lot of really great dentists out there, there's a lot of really bad ones too. So right now, offices, because of the COVID-19, are being asked to close until April 14th. This is March 23rd, so about another month-ish, 3 weeks. We'll just kind of wait and see what happens at that point, but that's a long time for people to wait, and I'm a little nervous as far as like what, again, people are going to do for jobs in the meantime. So if you want to check out Damsel, I'll be doing some other videos on my other channel. You can check out the other channel here. So some of the truly ugly stuff that's going on right now is the hygienists that are still working and the assistants and the dentists are being asked by their boss to use like 1 mask per week, not even per day, like per week. And the problem with that is your mask is only rated to be protective for an hour. As soon as like your condensation from just breathing moistens your mask, stuff can get into it. So you'll see these people in China that wear the same mask for like a month. It's doing them absolutely no good. You wear it for an hour and you throw them away, and you wear it for an hour and you throw it away, and you're not touching it, you're not, putting it back on. But yeah, I'm hearing stories of people actually having to wear the 1 mask for an entire week, and that freaks me out, because then you, let's say, have virus on it and you are now sitting over the top of the next person, possibly transferring it to them. And that just seems idiotic to me, but whatever. So we've got that. And then we have people that I personally know that don't properly wash their hands. And we've got, I don't know, there's a lot of stuff going on with this now that's like, but it's bringing things to light too. So I'm hoping a lot of stuff will change for the positive once this is over, and people will, kick themselves into gear and actually like make a difference and do what they're supposed to do and treat everybody like they've got AIDS. Because that would be great if it's just, it protects everyone. It protects everyone. That's the whole idea. Universal precautions. So how's this going to change dental hygiene in the future? I think there'll probably be a lot stricter in offices for patients that want to come in when they're sick. Like if they show up sick, they'll probably be escorted right back out the door. Say, you know what, we're just going to reschedule you. No big deal, but bye. I'm hoping that, doctors won't make the hygienists work when we're sick. And, same thing with the assistants, that they won't be forced to come in when sick. I think there will be probably a lot more people paying attention during the OSHA trainings, which we all love to sit through because they're boring as all get out. But I'm hoping people will actually start to pay attention. Another thing watching the hygiene boards is there is a lot of talk all of a sudden about unionizing. And people would be able to be more protected when this kind of situation happens. But yeah, there is a huge push right now to unionize dental hygiene. And we'll just kind of see how that goes. If you guys are thinking of getting into dental hygiene, keep your eye on that. That's going to be key for your future. So one thing I know everybody's worried about when this is over is let's say everything calms down by April 14th and the offices are allowed to open, schedule patients for cleanings again. If you have somebody come in that could be infectious, and let's say somebody in the next cubicle hears them coughing or something, if that person gets sick, they will say, you know what, I got it at the dental office, and they're going to start suing their dental offices. And so I'm hearing a lot of people that are nervous about, hey, when we do go back to work, are we going to be infecting other people? Are we going to be in trouble legally? How is this going to affect everybody in that way? There is the chance that somebody's going to come and say, well, I got sick and this is where I got it from. And then what are you going to do? So that's kind of an issue people are concerned with at the moment. And last but not least, for those of you who are thinking about going into dental hygiene, Alicia from last week's interview, I talked to her before I released the video, and she was saying how she's really nervous because she was supposed to be taking her national boards, which are the written boards, right after spring break, which had and her school's, like everybody else, is kind of done for the year, so she's not able to take her written boards, which means she can't graduate and take her clinical boards. So all of that is being pushed off into the fall semester, which means she has to go another half year before she can actually graduate and start working and start paying off her school loans. And so economically, for her personally, that is going to be a big burden. And it's not just her, it's all the other hygienists that are in school right now are all having the same problem. We can't study online like a lot of other types of careers can. You are in somebody's mouth. There is that tactile that you have to learn. You can't do that at home over video chat. So and they're kind of to the point in their schooling where it's all on clinic at this point. There's no real classes left to do. So I feel really bad for people that are doing hygiene school right now because they're having to be put off, and that's crazy. It's so crazy. If you were thinking about hygiene, again, it's still a fabulous career, but some more stuff to think about. That's a video for the week. COVID-19 and dental hygiene. Wow, what a ride. We'll see what happens from here. So everybody stay safe. There's some really interesting stuff out there. Take high doses of vitamin C, get out in the sunshine, make your own vitamin D, get that. This time of year, it's cold outside, but I'm still outside every day if I can for just a few minutes to try and get some vitamin D naturally. Get your liquid vitamin D, take your zincs and your multivitamins and your, get rest. Don't panic. That drops your immune system. Stay away from sugar. There's lots of stuff you can do to build up your immune system. So, chill out and stay safe. Keep your distance from people. Wash your hands. Everything we're being told to do. Anyway, so have a great rest of your week, and I will talk to you guys later, and leave those comments below. I want to know what your guys' thoughts on all of this are, and let me know what you're doing to stay safe. Take care. We'll see ya.